A simple insurance mistake delayed cancer care for a veteran who had already fought for his life. That is the part that should stop us for a moment. A man recovering from throat cancer needed ongoing therapy to regain his ability to swallow. His care plan was clear. His doctors were ready. But treatment stalled because of a basic insurance classification error. A secondary vision plan was mistakenly treated as primary coverage, and that single administrative detail triggered repeated claim denials. What followed was not a clinical disagreement. It was a system failure playing out in real time. Appointments were delayed. Therapy sessions were interrupted. Stress increased for both the patient and his family. All of it connected back to a data mismatch in an insurance system. For many physicians, this story will feel uncomfortably familiar. Healthcare today is no longer only about diagnosing and treating disease. It is also about navigating systems that decide when care is approved and when it is delayed. Increasingly, those decisions are influenced by administrative processes that sit outside the exam room. Across practices, the pattern is becoming harder to ignore. Insurance denials are rising. Prior authorizations are slowing down treatment. Billing systems are rejecting claims that are medically appropriate. Staff are spending more time on appeals and phone calls than on patient-facing work. Patients are often confused about coverage, and that confusion frequently lands back on the physician's desk. Most physicians did not enter medicine to become experts in insurance rules or documentation requirements. Yet many now spend significant portions of their day managing exactly that. The result is a growing gap between clinical intent and operational reality. Behind the scenes, healthcare systems have become more complex over time. Administrative processes now consume a large portion of healthcare resources. Small errors in data entry or classification can create large downstream effects, including delayed care, interrupted treatment plans, and financial strain on patients and practices alike. The emotional impact is also real. Physicians are trying to deliver care while simultaneously navigating repeated administrative obstacles. Patients assume their doctor controls these decisions, which adds another layer of pressure to an already strained relationship. This creates frustration on both sides, even when everyone involved is trying to do the right thing. The truth is, this is not just an isolated case. It reflects a broader system challenge where administrative processes can directly influence clinical timelines. A simple mismatch in information can determine whether a patient receives timely care or waits weeks for resolution. So what can be done in the middle of all this? Practices that are managing this will tend to focus on a few practical steps. They closely track denial patterns to identify repeat issues. They strengthen insurance verification before appointments rather than after claims are submitted. They standardize documentation so medical necessity is clearly supported. They build faster appeal processes so delays do not drag on indefinitely. They also invest in staff training because insurance rules change constantly. Finally, they communicate more clearly with patients so expectations around coverage and timing are understood early. None of these solutions are perfect, but together, they reduce friction and help protect both patient care and practice stability. Looking ahead, healthcare will likely continue to shift toward more operational complexity unless systems are redesigned. Administrative decisions will continue to influence clinical timelines. Physicians will need to understand not only medicine, but also how systems around medicine function. This is not about replacing clinical expertise. It is about recognizing that operational systems now sit directly alongside clinical care in shaping outcomes. The story of one veteran's delayed treatment is not just about insurance. It is about how easily care can be interrupted when systems fail to communicate properly. And it raises an important question for all of us working in healthcare. How much longer can we accept administrative delays as a normal part of patient care before it begins to meaningfully affect outcomes at scale? If you're a physician, clinic owner, or healthcare professional who has experienced similar challenges, share your perspective. These conversations matter because change starts with shared awareness. If this resonates with you, share it with a colleague who needs to see it.